Have you heard about the new COVID-19 variant that's spreading this holiday season? A fresh face on the block, the JN.1 variant, is making its presence known. This recent member of the COVID-19 family has been reported to account for over 1/5 of all cases in the United States. With estimates varying, some suggest it could be responsible for between 15 to 29% of infections, hinting that JN.1 may be more transmissible and potentially better at slipping past our immune defenses. Now, if you're wondering where this newcomer hails from, it's a descendant of the Omicron family. However, this doesn't mean JN.1 carries the same risks as the original Omicron variant. Each variant has its own unique characteristics and behaviors, and we're still learning about this one. But before you let worry set in, remember this. Despite the rise of JN.1, there's no need for panic. Let's delve into why. So what does the rise of JN.1 mean for us all? This new variant is making its presence known, accounting for up to nearly 1/3 of all COVID-19 cases in certain areas. It's particularly prevalent in the Midwest and Mid-Atlantic regions, where hospitalization and death rates remain high. This paints a stark picture of the variant's impact and its potential to strain our healthcare systems. But let's take a step back and understand what this really means. While the numbers might seem alarming, it's crucial to note that there's currently no evidence that JN.1 causes more severe illness than previous strains. What this means is that while it may be spreading quickly, it doesn't necessarily result in worse outcomes for those infected. And here's another crucial piece of information. Our current vaccines and treatments have not been rendered ineffective against this new variant. That's right. The vaccines that we've all been rolling up our sleeves for, they're still our best line of defense. This is an important reminder that getting vaccinated, if you haven't already, is a key step in protecting yourself and those around you. But what about those who've already been infected? Well, previous infection can also help reduce the risk of serious illness from JN.1. So while the variant is certainly a concern, it's not an insurmountable one. While the situation might seem daunting, remember that we have tools to combat this threat. Now the question arises, how can we protect ourselves from this new variant? First and foremost, vaccination remains a critical tool in our arsenal against the JN.1 variant. Vaccines have proven to be effective in reducing the risk of serious illness, and this holds true for this new variant as well. If you haven't been vaccinated yet, now is the time. If you're eligible for a booster, don't hesitate. Vaccination doesn't just protect you, it also helps protect those around you, especially the most vulnerable among us. In addition to vaccination, we need to be mindful of our surroundings. Covering our faces with masks in densely populated indoor areas is a simple yet effective way to reduce the spread of the virus. This is especially important for those who are at a higher risk, such as the elderly, individuals with underlying health conditions, and those who are immunocompromised. Remember, while the JN.1 variant might be a newcomer, our protective measures are tried and true. Washing our hands frequently, maintaining physical distance where possible, and staying home when we're not feeling well are all part of the package. It's also important to stay informed. As we learn more about this variant, guidelines may evolve. Keep up to date with reliable sources, and don't hesitate to consult healthcare professionals if you have any concerns. This might seem like a lot, but these are small steps that can make a big difference. They help protect not just ourselves, but our communities and our loved ones as well. Even in the face of new challenges, these measures remain our best defense. Let's quickly recap what we've learned about the JN.1 variant. This new strain of COVID-19 is now accountable for over 1/5 of all cases in the United States, with estimates ranging from 15 to 29% of infections. Its lineage traces back to the Omicron family, but it doesn't pose the same risks as the original Omicron variant. While it may be more transmissible and better at evading immune systems, there's no evidence that it causes more severe illness. More importantly, current vaccines and treatments remain effective against it. The rise of the JN.1 variant, while significant, is not a cause for panic. Vaccination and previous infection can help reduce the risk of serious illness from JN.1. Experts continue to recommend getting vaccinated and taking precautions, such as wearing masks in densely populated indoor areas, especially for vulnerable populations. As we navigate this holiday season, remember to stay safe, get vaccinated if you haven't already, and continue to follow recommended guidelines. Together we can overcome this.